Hello बच्चों, क्या हाल चाल? I am very excited today. I didn't know what I had for lunch today. I am very excited to meet all of you guys and talk heart to heart. I got a script very recently, so I'm not going to look at this at all. I'm going to just talk what comes to my mind. To the youngest of the medicos, the first year students, how's it going? Got ragging is over? Got introduction with your seniors? Freshers party is done with? And I hope you're starting to read, right? And second years, my personal favorite because I'm enjoying Essentials batch. Not just that, the RRR series, the motto is to make sure the entire country is going to read one book and only book, which is Robbins Pathology. And the old second year students, where your exam must have been over, right? So once the exam is over, you must be wondering that results have come. Should I start reading or should I wait for some bright moment to happen? Same with final years, moving from third year to final year. And your medicine, surgery, OG, pediatrics, orthopedic, psychiatry, dermatology, radiology, many things, right? Still wondering. NEET PG students, INICT students, FMG students, still waiting for NMC to postpone it further. If you are waiting for it and some big start to happen, it's not going to happen, but we have something for you. We have a special surprise for you, and that's about Vishwas Diwas. PW's Vishwas Diwas is a very special event, not just for PW. It's a very special event for the entire country. Like the Indian Army has Vishwas on all the 140 crore Indians, the students have Vishwas on PW. And for MedEd, it's a very special occasion because we were launched in the last Vishwas Divas and it's been 1 year. 1 year of constant pushing, 1 year of trying to make it the best, and 1 year of hardcore struggle. And my 1 year of trying to learn Hindi. Sirf thoda aata hai. I'm trying to do my level best. I have a good student, Lalit, Dr. Lalit, who's going to teach me Hindi. Hopefully in the next Vishwas Divas, let me learn that as well, right? Bit old, but I'll try my level best. If you guys can excel pathology, I am going to try and excel Hindi as well. So 1 year of constant working to make the product best for all the students available. And it's 1 year. We cannot leave without a surprise, right? We cannot leave without a prize drop. So after 1 year of successful thing doing in MedEd, we have a huge drop in price. If you can look at this, you have first prof, you have extra validity of 12 months plus 1 month at just 4,250. Second prof, which includes your patho, pharma, and your microbiology, live lectures, recorded lectures. Because, you know, I feel that when you're very early, recorded lectures alone is not enough. Someone had to hold you and say that, read. Someone has to hit you and say, there's a batch going on, there's a class going on, sit and read, right? It's very essential. For the first and second prof students, live batch is extremely essential, I feel, right? Hello, Dr. Manish. So I feel that that will help you and give an edge over every other competitors, right? So here, I have 12 plus 2 months for just 4,750 rupees. And you have third year batch for all the students in second year, saying that I have to attend clinics, I have to attend postings as well. I have to learn for third year also. What do? You're going to have a surprise where all my faculties are going to tell you what they have special for the Shushruta batch. That will be a groundbreaking thing, which will help you to sail your third year as well as make a superb entry into your final year, right? And you have final year subscription. Intern, post-interns, if you're worrying, there's no other place you can get at 10,999. Recorded lectures, live batches, PYQs, your question banks, test series, and whatnot. And you also have videos for the Q banks, right? If you find something, we will be there to help you there. And ASAP batch. ASAP batch is something which is very close to us. With the help of Dr. Manish and Dr. Harab, we have come up with an amazing thing which is required for the younger students. What is lacking? Do you want rapid revision videos? It's there. Do you want a live TND? It's there. Do you want a very short 2,500 questions? If you cannot do 20,000 questions, it's there. PYQs, it's there. Do you want it for cheap? It's there. So we understand every pain point of every aspirant, and we make sure for all the FMG, INICT, and NEET PG preparing people, just for the next 4 months, you're just going to pay 2,499, where you'll have rapid revision videos, your live TNDs, your Q banks, your test series, and whatnot. We are just going to struggle more and more to make you successful, right? That's what our ultimate goal is. If you have any doubt, do let me know. And these are the offers. And one more thing, I'm going to let you a secret. Please don't tell to anyone. MedEd 2.0 is coming with many new features, with more lectures, with a better, even better notes, amazing images, amazing descriptions, and many more. Maybe next level of intelligence might also be coming inside. And with all that, there might be a little bit hike in the price. So use this discount offers for the Vishwas Diwas, and I hope you will enjoy all the advances we're going to make in the app, and we are constantly listening to you. Anything you have, doubts, do let us know. We are there to help you guys. What are you waiting for? Click on the link below, download the app and subscribe, and let's learn pathology and medicine in the best way possible. Do you have any doubts, guys? If so, let me know. I'll clarify it. Using the smart board for some time, very rarely, so I have to look at the comments in the below section. If you have any comments, do let me know. Hello, Shubham. Hello, Shreyash. Hello, Dr. Manish. Yes, you will definitely get PYQs in the TND, right? So the concept of TND is very, very simple. When you have a test and a discussion, the focus should be very correct, right? Because if you have just 3 months or 4 months for your exams, for the NEET PG exams, you cannot keep on reading multiple things. So all the TNDs will be in and around the PYTs, previous year topics, and yes, you will have an access to the PYQs as well. You will have a PDF which will be available for you before the TND starts. Try to solve it. While the TND is there, try to add few more points if you don't know. If you had made any mistakes, go back and solve them again. And if you missed it, you'll have the recorded options of the live also available. So everything will be available for you, Dr. Manish. Understand, the prof-wise batches are there available already. The first prof, second prof, third prof are mainly focused to the university exams. They will also have the recorded lectures. See, because the journey of a student is very different. When you're starting to learn, you might want to learn everything in detail. But let's say I'm going to take 120 hours of pathology. It will be too much when you go close to the exam. That time we will have the concise recorded lecture, and also we have Foray series and Foray questions. That's previous year university exams, right? So that is primarily target for your university exams only, Anston. Sakshi, I would say whatever is okay for you, the older videos are okay for you or the current videos are okay for you. I am okay with both, because the teaching of the older batch and the current batch will not be drastically different. If you can sit and watch, because most of the students are asking that in their college, general pathology is over. I cannot rush that much, right? Then you won't understand that. That's why we are going in a pace that we will complete the syllabus in 6 to 7 months. If you want to go and have a look at the old, please be a guest. You can look at any one of them. It's up to you, right? Sure, Islam, we'll look into the BDS for sure. Kevin, personally, handwritten notes are the best. I always say this, faintest ink is stronger than the strongest memory. Write it down. So when you write something, you will process automatically. You must have heard about Vernix and all these Broca's area, right? It'll process everything, then you will write it down. That makes your concept clear. But if you feel it's difficult, the soft copy notes will be available both for the live batches and the recorded videos for you. Nemain, just wait for a couple of days. We have a superstars coming here, and you will not regret it at all. ENT, Opthal, Forensic, PSM. Not just that, there's even more, a little bit of surprise for you. I am not going to reveal it for you. We'll have our superstars coming in a couple of days. They will tell you what exactly to be done. The faculties are extremely experienced. They have been teaching a collective cumulative experience of more than 30 plus years of teaching. So don't worry about it. We are there for you, and we'll make sure every pain point of yours is addressed. Be it your clinics, we have got it sorted. History taking, we have got it sorted. Examination, we have got it sorted. Prof exam, we have got it sorted. And every lecture will have DPPs. NEET PG preparation, we will have got it sorted as well. Most welcome, Kevin. Any other doubts, do let me know. Dr. Preeti, yes, definitely you can have an entire subscription here. If you go to the intern pack, which will have all the 19 subjects, will have the subscription for the entire MBBS, and you have subscription validity from 12 months to 60 months. So you can choose whatever you want. Go into the app. If you have any concerns, please ping us on the Telegram. We'll help one of the counselors to help you and guide you in the what is the best plan which will be available for you. Harshvardhan, if you got the hard copy notes, you have to just add on to it. Every hard copy notes of PW is made such that you'll have a gap in the side. That's for rough work. So if you add anything extra, add on to it. If you feel that there are entirely new videos, don't worry, we'll help you in that also. We'll make sure the gap is being bridged. Most of the new videos are for prof oriented. So if you've completed that prof, the recorded lectures what you already have should be more than enough for you to ace your NEET PG exam. Any other doubts, guys? Some issues. Naman, why are you waiting till the last day of the offer? You like it? You want to learn it? No second thoughts. Don't procrastinate. Buy it immediately and start learning from today. Last day, no, it's not good for us. We'll at least not procrastinate, at least for this time. Let's learn together, Naman. Ali reacts. Okay, you've not done anything in the second year. Fine, got it. See, if you are entering your third year, it will become a little bit hectic for you. So I would give you an advice. Let's say in third year, you are going into your clinics. You are seeing a patient with diabetic foot, just for an example, in your surgery department. You read that relevant thing from surgery, go to the pathology of the diabetes, complete that slightly. If you're seeing a patient with a gastric carcinoma in your surgery postings, read gastric carcinoma, come back here. If you're seeing rheumatic heart disease in your medicine posting, read medicine part, come back to pathology or pharmacology, whatever is related, right? So that's the best way for any student who has gone beyond third and fourth year to kind of revise slowly, and when you see patients and you revise, no, that'll be much more comfortable. Nemain, it will be done. See, Nemain, what we are going to do is, if you take CBME curriculum, I'll give you a brief example. Robbins is a very vast book. If you take CBME curriculum of Robbins, let's take genetics chapter. Genetics, what CBME wants you to know is just Mendelian, non-Mendelian inheritance, that's all. Not even about Marfan's, Ehlers-Danlos or Turner's or Downs, right? So whatever is required for a prof exam, we are going to stick on very hardly to CBME curriculum. So if it's not there, it's not required here as well. In skin, what is required is tumors of skin. That will be automatically covered. In bone, again, classification of tumors of bone. That also will be covered. Don't worry about that. Leave it to us, Naman. We'll take care of you. Nimen. Most welcome, Ali. Hopefully, when you come to next year, fourth year, I want to hear from you that you have completed both second and third year and you're waiting for the fourth year with happiness. Any more doubts? Let us know, guys. I'm looking down because I need to look at the comments, so I'm chatting for you, fine? So if the no more doubts, if all the doubts have been clarified, if you have any more doubts at any point of time, ping any one of us in the Telegram group or get in touch with any of our counselors, or if you want to get in touch with me, connect with me in social media, we'll be more than happy to help you guys. Okay, Sakshi, this is a very good question. If you've gotten into a second year and if you feel your first year is not that strong, right? Because first year is the foundation. That is absolutely the foundation. Sakshi, can I ask one thing? Like, have you got early clinical exposure for you guys? You got first, even in the second year start, you will have seeing patients. Yes. So what you do in second year start is you go and see patients, take history. You auscultate, right? You look at the stethoscope, use and hear the sounds. The same way, whenever you read pathology, I will definitely cover a little bit of relevant physiology to that tissue. The same thing goes for microbiology, pharmacology as well, right? Again, when you start clinics, when you see a patient, I want you to go back, spend like 20-30 minutes on that alone. You're in medicine posting, reading about CVS. Go to cardiovascular physiology alone. GIT, go to GI physiology. Pediatrics, go to developmental physiology, embryology, right? So in that way, it's not reading the entire physiology, breaking it to 20, 200, 300 subtopics and reading it like 10, 20 minutes. You will never feel the burden, fine? Try to doing that, that will be good. Pranav, don't worry. Robbins will help you for sure. I'm here to say that Robbins will definitely help you. Internals has a very easy trick. You have to look at the highlighting points. You have to present well. You will have to break down into tiny concepts. So that's what I'm trying to do in RRR. So in the RRR series, the only motive of RRR is to make sure, okay, it's a big page in Robbins. How do I break them and how do I present them? Robbins will help you, not just for your internals, not just for your NEET or INICT, throughout your medical career, it will help you. Please don't switch that, at least for general pathology, right? It's my humble request, and I'm 100% you will feel that it will be useful. You try reading it now. I'll talk to you after 4 years. You will definitely tell me reading Robbins in second year was the best thing I did. For a short-term goal, don't miss the long-term thing. Our destination is only one, not marks. Your destination and my destination is only one, seeing patients, making sure they are well healed and well treated, right? For that, Robbins is ultimately essential. Great. I'm happy that I am able to help you, Namain. Sakshi, if you've come to second year, I would say go with AKJ because Guyton will be a little bit bigger at this point of time to read along with the second year. That's why I'm preferring AKJ. Or I would say whatever book you read in your first year, try to do that. So it's not too much of a burden to read a new book. Rishabh, I am not the right person to answer that. You have to talk to your college management. If your attendance is low, NMC is becoming more stricter these days regarding attendance. Please talk to your college management. They'll be the right person to guide you regarding that. Great, Naman. And we are going to follow the footsteps of Naman. No one ever is going to procrastinate. It will happen, but at some point of time you should say, no, I am going to do it. That's all. Let's do it today and let's do it now. Fine. Okay, guys. See you. Signing off now. And thank you for all of you for the patient listening. If you have any doubt, contact any one of us. We'll be more than happy to help you guys. Bye-bye.